Good morning. I'm Dr. Ruddy. Welcome back to Herd Immunity, where wisdom is your best defense. I want to speak to you this morning about the increased viral load that is being detected in vaccinated patients who have developed Delta COVID. Now that's a lot to say, huh? And I'm sure you're like, what is she talking about? It's easy. I'll take it one little step at a time. Let's define first what is viral load. You may have heard this phrase recently, particularly with regard to vaccinated patients who are now coming down with Delta COVID. So what is viral load? Viral load is like industrial output. It's like the GDP, right? Gross domestic product of a person who's infected with the SARS virus. So the more viruses you have inside you, the more viruses are inside your cells, they hijack them, they turn them into factories, the more output there is. Viral load. Industrial productive output of the SARS virus. Now, why are we finding that patients who've been vaccinated, fully vaccinated, who now are bumping into the Delta COVID variant, why are they getting sick, number one? Number two, why are we finding that they have an increased viral load? I have been speaking about this off and on for the past 10 days. Let's reconsider antibody-dependent enhancement, ADE. Again, if you're new to this channel and this concept, very, very simply, ADE is a situation in which an individual has been exposed to the SARS virus, develops antibodies to that virus, two kinds of antibodies, which I metaphorically describe as SEAL Team 6, 101st Airborne, Black Hawks, okay? The big guys. And a secondary defense set of immune cells, which I refer to as the militia. They have brooms and sticks. Their hearts are in the right places, but they just are not up to the big job. Fine, okay. The second time that individual is exposed to the SARS virus or a variant, or bumps into it as a result of a vaccine, for instance. We've seen this in plenty of animal studies. And in human situations involving other viruses like dengue. When that individual bumps into the SARS virus again, out comes the 101st Airborne, SEAL Team 6 and the Black Hawks, okay? But also the militia. The militia show up, except the militia have changed sides. The militia are traitorous. The militia escort the virus, this new exposure to SARS virus, escort them into the cell, more cells, and now you have a robust, larger than life industrial output. You have an increased viral load. So let's go back to the beginning. We are seeing an increased viral load, industrial output, in patients who are fully vaccinated, who have developed COVID as a result of infection with the Delta variant. ADE is not a failure of the vaccine. So ADE is not vaccine breakthrough. ADE is a consequence of having seen SARS previously, developed a substantial immune response, plus an insubstantial immune response, which in subsequent infections becomes a tyranny of traitors. Right? That, I think, explains, hypothetically, I think it explains what we're seeing now in patients who've been fully vaccinated, have developed COVID related to Delta variant and are now found to be expressing an increased viral load, which they can detect with PCR tests and what have you. Okay. Right. So this is something to be concerned about. Let me just say that in the past 24 hours, I have had to deal with patients and friends and associates who are wildly afraid of Delta variant. I heard of a woman who has been fully vaccinated. She's perfectly fine. She has no symptoms. She's in the car. She's in line at the drive-through to get a PCR test. She's terrified because she may be sitting in line with a lot of people who have Delta. She wants to be tested to see if she has the Delta variant. I'm like, stop. Stop. I mean, if this were a Hollywood comedy, it would be Animal House. If it were a Hollywood blockbuster, it wouldn't be as scary as it is being promoted. Please relax. We have medication, by the way. And even if the Delta variant is more infectious than the original Wuhan one, and there's some suggestion of that, but let's just see what the final analysis looks like. Even if we have medication, this is not the end of the world. It's not. We can deal with this. We can. Please, go home. Do not be petrified. Relax. Lawyers are our first responders now. Remember, the two best medicines are love and mercy. Until I see you again, God bless.